Hello, my name's Jason and thank you for listening to my brief presentation regarding my poster. This is an evaluation of an educational module for practitioners wishing to upskill in the perioperative care for the older patient undergoing surgery. And starting with a bit of background, we know there are increasing numbers of older patients having surgery, with these patients at higher risk of adverse post-operative clinician-reported and patient-reported outcomes. And there's recognised benefit of having an integrated or transdisciplinary approach to supporting these patients, but also know there's limited funding for new services and likely not enough geriatricians to support these services going forward. So the question is, how do we upskill the multidisciplinary team to meet this workforce challenge? And we're often asked at conferences, how has POPs at Guy's and St Thomas's developed its multidisciplinary team to meet this workforce challenge? Now, we use nurses, but recognise allied health professionals are used in other services. And we sat down and started jotting down on paper what we felt were the essential knowledge and skills for someone wishing to work within perioperative medicine. And this quickly developed into a formal capability framework with detail knowledge and skills for that practitioner wanting to specialise in perioperative medicine. Now, the capability framework can be used to design your own bespoke educational resource, but we used it to design a 2-day course run virtually through MS Teams. This had learning outcomes tied to each of the topics, but it was also supported by an online module hosted through the British Geriatric Society. Together, these two components counted for around about 60 hours of CPD for the practitioner. The course was run and evaluated in October 2020 with 13 nurses and allied health professionals taking part. All reported talk content enhanced their practice, with one of the 13 feeling that the content was a little over their level of understanding. They were a band 6 nurse. All had issues with the online module regarding initially access and then passing of some of the integrated quizzes. Following the success of the evaluation cohort, we're now working with the BGS to redesign the quiz sections of the online module. We've secured funding from HEE to develop a credential in advanced practice using our curriculum as a template. We're working with King's and London South Bank to develop a work-based learning bolt-on so you can get academic for completing the module, and we will be running the next cohort in September of this year, hoping to run the course twice a year from then on. Thank you very much.